Hi everybody. I hope everybody is doing well today and had a great weekend. It's a beautiful day outside. It's a change from all the rain we've been having. Um, so as you guys know, I always ask people to send in their comments, questions, and things like that to my email, which is recoveryrealness247@gmail.com. I had one person write in asking me to do a video about methadone or M.A.T programs. So just like off the top of my head, to talk about the methadone. A lot of people's families don't understand anything about methadone, and I know that a lot of people in my family have issues with it, with me being on it. But it's like, hey, look, I'm almost in recovery, almost 2 years, and I'm not relapsing. I'm working on myself. I changed my thought process. I was just discussing with my clinical director this morning about how when I'm in a stressful situation, my first, second, or even third thought is not to go and use. It's nothing like that. I feel like I have come so far, and it's because of the methadone I'm able to have that opportunity being in a M.A.T clinic. M.A.T stands for medicated assisted therapy or medicated assisted treatment. I have this opportunity because of the M.A.T program, and I know and I totally understand that there is other ways that you can work on yourself and get that therapy without being on a M.A.T program, but this is what worked for me. And I always say, if it's not broken, don't try to fix it. There's no need for it. If your life is going good, you got a job, you have a social life, like you're living life as a normal member in society. Normal, there's that word again. There's not really any one particular normal, but basic. A basic person that lives every day doing the best they can without any drugs or alcohol. And what are you complaining about? And that's basically what I say to my family members when they want to start complaining to me about me being on methadone. I have a family member who I barely get along with. A lot of people say we don't get along because we're so much alike, and that really couldn't be the furthest thing from the truth. Maybe in reaction, loud, things like that, but I'm about 20 something, maybe 20 years younger than her. 20 something years younger than her, and I'm absolutely 100% more mature than she is, which is really, really sad. I'm 34. People say we look alike, and I get upset because, just because we share the fact that we have red hair and freckles and blue eyes. I take care of myself, she doesn't. Anyway, she found through my Instagram which, by the way, I always keep her at a distance because she's very, very toxic. And I do get along with one of her children. He's also in recovery, apparently, and he's doing really well. But she's comparing me to him. And I have children. He doesn't. I was on a different drug than he was. And, I was actually on multiple different drugs than he was. And she's comparing my recovery to his. You cannot compare two different people's recoveries. It's just different. No two recoveries are the same. So back to what I was saying about her. She went on my Instagram, which she doesn't have access to anymore, and seen that I'm doing really well. and that I have goals. And one of my many goals is eventually, once I hit my 2-year mark in February, I'm going to be going back to school, and I want to, get a certificate to be a peer specialist. I think it's called a CPS, a certified peer specialist is what it's called. So, anyway, so I should be going back to school for that. So she's seen all of these things that I'm doing really well and helping people find treatment, making videos on YouTube, this and that. And she messages me and says, hey, so glad you're off the methadone, blah, blah, blah. And I'm like, what are you talking about? I'm still on methadone, and I'm doing really well regardless. And then she starts lecturing me, even though she has no fucking knowledge about methadone. When people hear methadone, they think of, heroin addicts and that the addict face, which it doesn't have a face anymore, but this is what people think of, junkies, homeless people, things like that. And they think of me as different than that. And it's not true. I mean, it is what it is. I did heroin. I am a recovering drug addict. There's no other way of looking at it. I fucked up, and I got myself some help, and I fixed it. Well, I'm in the process of fixing. So, when I say this to her, she's shocked. She's absolutely shocked. How could I still be on methadone and doing that good? And the answer is because I'm doing good because of the methadone. Methadone, it helps with cravings, okay? It completely, if you're on the right dose, it completely takes away your cravings, okay? I mean, sure, they pop up every once in a while, even if you're on a good dose. But that's what we use our coping skills for. And then also being a partial blocker. It's like, why am I going to waste my money if I'm not even getting high? So that's where the harm reduction comes in. If you can go about your day and say, I don't need to use today. I don't need to rob somebody. I don't need to, steal from a store. I don't need to sell my belongings. I don't need to find a sitter for my kids so I can go and cop. And I do not need to bring my children along with me to do that either. I mean, this is what methadone is for. It is harm reduction. And everything that I'm saying today about methadone could also be applied to Suboxone and Subutex and any other type of medicated assistant treatment. So, just putting it all out there, being 100% honest. I'm not ashamed of my recovery. I'm not ashamed of my past. I'm actually really proud of myself. It is not easy. It is not easy to walk around telling people that you're on methadone because they're constantly judging. And a lot of things with addicts is that, we use every excuse possible to go back and use. Well, they think I'm going to fail, so I'm going to prove them right. And that's where changing your thought process is going to help you along in your recovery. So the next time you have a family member that is toxic, and coming at you about being on a M.A.T program, just look at them right in their face and ask them, am I doing good? Have I changed? Do you see the positive changes in me? Yes. Okay. So why are you getting all up in my shit? If I'm doing good, why would you want me to stop doing what I'm doing? You want me to go back to using? You want me to suffer with the cravings? Do you want me to, not work on my, what is it? What is it that you are so offended that I'm on a M.A.T program? Why is it bothering you? It's not affecting you in any way, shape, or form. So why? Why? If it's helping me, and I'm a good mom, and I wake up every day and I do things with my children and I get them to school on time, I'm not worrying about going to get no drugs. I'm not worrying about what I'm going to sell. I mean, what more could you possibly want for somebody that you love, supposedly care about? I mean, that's all these people have fought for us. Our family members have fought all these years trying to help us get treatment or get clean, And now that we're clean, you want to complain about the way we did it. So that's really not cool. And sometimes you have to be absolutely 100% blunt with your family members in order for them to get it up here. Okay, you see me, you have eyes, you can see. Obviously, I'm doing really well, you know? So what the fuck you want me to change shit for? Why fix something that's not broken? You just don't. You don't, okay? Sometimes people are on methadone for the rest of their lives. But here's the thing. Don't worry about future. And this is what I tell my friends that are also on M.A.T, new to M.A.T programs. Don't worry about tomorrow and the next day and the next day. Don't worry about 5 years from now. Don't even worry about a year from now or 6 months from now. You focus on what you're doing today. Don't worry about how long you're going to be on this M.A.T program or how long you're going to be on methadone, because it's not important. What's important is right now, the present. Fixing yourself, changing your behaviors, changing your thought process, you know, getting better every day, getting these drugs out of your system, taking your medications the way you're supposed to as prescribed, no more, no less. All right, you're just doing the right thing. You get a job, you get on your feet, and you show yourself, because that's what's important here, is showing and proving to yourself that you are a strong, beautiful, intelligent citizen, and you can go about your day and be happy and choose your behaviors and take responsibility. You're not always going to be right. You're not always going to do the right thing, but it's all about accepting responsibility and moving forward. You learn from your mistakes, and there's nothing wrong and nothing weak about acknowledging the fact that you're wrong and fixing it. That makes you a strong individual, and only strong individuals can do that. So keep that in mind. All of this has to do with getting better, and that's the main goal here. How you do it, as long as it's the right thing to do, and I'm not talking about going and get kratom or some bullshit like that, or you know, tapering off heroin by using a different drug. I mean, doing the absolute right thing and getting yourself clean and detoxed and changing, you know, all your behaviors and your thoughts and the people's places and things. As long as that's done the right way, what are you complaining about? Please tell me. Because when I ask, they don't have an answer for me. Like, what are you complaining about? So that's it. You just got to be blunt with some of these people, because you know what? Don't think about their feelings. They ain't thinking about your feelings when you're sitting there, you know, being harassed and bullied for being on a M.A.T program. They're not worried about how you feel. So don't worry about their feelings. And again, and I've said this before, I'll say it again, you have to love certain family members from far away, okay? There's nothing wrong with that. So just keep that in mind, and you know what? You got to learn how to love yourself, how to appreciate yourself. You got to learn how to say no. You also learn how to say yes, because sometimes there are things that, you know, we will not do because it takes us out of our comfort zone. But if it's a good and positive thing, say yes. And learn how to say no to the toxic situations and the toxic people. And sometimes our own worst enemy is ourself. We could talk ourselves into anything. So the next time you want to talk yourself into something, talk yourself into changing and becoming more positive and looking at the bright side of things instead of being so negative. And people are going to see this change in you, and eventually they're going to stop fucking with you. But being blunt and honest, there's no better response that you can give a friend or family or even a stranger when it comes to being on a M.A.T program or being on methadone, Suboxone, Subutex, whatever. Okay, so just keep that in mind, and I hope you guys have a really great day. I hope I answered this guy's question properly in dealing with toxic family members harassing you about being on methadone. And also, before I go, just another suggestion. If you want to know about, you know, what you're doing, because you should, regardless of whether they're fucking with you or not, you should always know what you're taking, what you're putting into your body before you make a choice about anything. So Google that shit. Like, literally, like, look up everything, the ingredients, what it does. You know, all this knowledge is out there waiting for you to find it. And, you know, you could always learn. There's always room for improvement. There's always room for more knowledge. And it's just a really good feeling when you can sit and, you know, when you're, you know, in front of people and they're asking you questions and you could fucking answer them and be like, yeah, bro, like, you know, and it makes you feel really good about yourself too. So keep on learning. Google that shit. Google the benefits of methadone. Study that shit. It's good for you, and it's good for your family members to know also. All right? Have a great day, and if you guys have any comments, question, you need advice, whatever it is, email me, recoveryrealness247@gmail.com. Don't forget to subscribe to my YouTube channel, Recovery Realness 24/7. Okay, don't forget to subscribe, like, share, and comment. Good seeing you guys. Bye.